Everyone, thank you so much for joining me on my presentation of the Women Walking for Wellbeing program in Randolph County, Georgia. So to begin, I wanted to start with a little bit of information on Randolph County, Georgia. Randolph County is located in southwest Georgia and has a total population of 6,270 residents. Approximately 68% of the population is African American. There are approximately 3,144 patients to every one primary care physician. The median income in Randolph County is $25,425, which is about 1/3 of Georgia's median average income. The poverty rate in Randolph County is 26.8%. Of the 26.8% of Randolph County residents living in poverty, 72% of those are African American. Additionally, the largest demographic that makes up those living in poverty are African American females between the ages of 18 and 45 years old. Health disparities and inequities often disproportionately affect African Americans and people of color. These health inequities may be longer emergency room wait times, or even these health disparities these health inequities and disparities often result in longer emergency room wait times and even lead to poorer health outcomes. Based on the health inequities, disparities, and data from Randolph County, the priority population for this program are African American females between the ages of 18 and 45 years old. Now that we have identified our priority population, it is important to look into some health data from Randolph County. The fourth leading cause of death is cerebrovascular disease, often referred to as stroke. According to the Healthy People 2030 objective, the current status for reducing stroke deaths is getting worse. Female stroke deaths between 2020 and 2024 were at 54.3% in Randolph County, with approximately 52.6% of those being African American females. Some risk factors that were identified using health data for stroke are physical inactivity, adult obesity, and food insecurity. One of the most important aspects to our program is the collaboration and participation with the community of Randolph County. In order to do that, before the program planning, we would like to hold open discussions with all members of Randolph County, where you can come in and you can express to us your concerns, your fears, your challenges, your barriers, and what the facilitating factors for physical activity are. In addition, we would also like to partner with local physicians, behavioral therapists, women's advocacy groups, as well as members of the priority population that maybe don't fit the requirements to participate in our program. Our program is looking to partner with local healthcare organizations and physicians, as well as behavioral therapists, the Atlanta Women's Foundation, and most importantly, members of the priority population that may fall outside of our age range in order to participate. The final part of our program planning and the first part of our program evaluation is to develop a logic model. A logic model determines the resources that are needed for program implementation, what the activities of the program are going to be, participation for the program, and most importantly, the short-term, medium-term, and long-term outcomes/impacts. The long-term outcomes/impacts will be used as our program goals. And for our program goals, the objectives that we will be using will be determined from our short and medium-term outcomes/impacts. So before I move on to our program evaluation, I wanted to give you all a final program overview. Our program aims to increase physical activity through walking, which is able to be achieved through the course of our participants' daily activities. We hope to do this using pedometers as a motivational tool. Education will be a key component of our program, using weekly meetings to educate participants on stroke risk, and how physical activity can decrease their stroke risk. We will also be using social cognitive theory as a theoretical framework for our program. Social cognitive theory states that individuals not only learn through their own behaviors, but through watching other individuals' behavior changes and what the results of those behavior changes may be. So while the slide may look like a lot of information, these are the goals and objectives for our program that we developed using the short, medium, and long-term outcomes/impacts in our logic model. The objectives highlighted in yellow were the objectives that we used to develop our evaluation questions that you will see in the next slide. Our evaluation questions using the objectives that we developed from our program goals are: how much did the participant step counts increase during the program? To what extent do program participants know stroke risk factors and ways physical activity decreases stroke risk upon completion of the program? And to what degree does increasing physical activity by walking actually improve the number of days participants feel healthy and full of energy? Our program will be 12 weeks long, and we will be using the evaluation design, which is the one group pre-test, post-test. The table below shows you what we will be using to measure pre-test and post-test data. This includes the CDC's HRQOL-14 questionnaire, a stroke risk and physical activity questionnaire, and step counts. For pre-test data, both questionnaires will be given to participants 1 week before the program implementation, and step counts will begin 3 weeks before the program implementation. All the post-test data will be collected upon completion of the 12-week program. So now the most important question is, what exactly are we using all of this to measure? Well, we're measuring the effectiveness of the program, and what exactly that is how effective were we in educating participants on stroke risk and how physical activity decreases their stroke risk. We also would like to know how effective we were in increasing participant step counts, and most importantly, how effective were we at improving individuals' feelings on their own health and energy levels. All of the pre-test and post-test data will be analyzed using the amount of change equation to determine the difference in scores. We will also perform effectiveness ratios to determine the amount of change that was achieved throughout the course of the program. Additional statistical analysis will be performed on all pre-test and post-test data. Overall, the Women Walking for Wellbeing program is aimed at decreasing stroke incidence and mortality, improving the quality of life of African American women living in Randolph County. We want to better the health outcomes of these women, and most importantly, we want to build friendships and strengthen the community through continued support, bonds, and motivation. Thank you for joining my presentation. I hope you enjoyed it.